Dear students, my name is Jordan Simeonov, and in this video presentation I would like to acquaint you with the so-called dirty dozen of pesticides and also the main toxicological issues of this group of chemical compounds. The Stockholm Convention on Persistent Organic Pollutants, POPs, banned or greatly restricted 12 chlorinated organic compounds, highly toxic, able to accumulate in the environment and to magnify through the global trophic network. Among them are 11 pesticides, namely aldrin, chlordane, DDT, dieldrin, endrin, heptachlor, hexachlorobenzene, kepone, lindan, murex, and toxafen. These compounds were named by journalists as the Dirty Dozen and were listed in annexes A, B, and C, respectively, of compounds for elimination, restriction, limitation of unintentional production. The main chemical properties of each of the pesticides members of the Dirty Dozen, including the chemical structure and the CAC number, are presented. Data for the toxicological properties of these chemical compounds, such as lethal dose, are provided, and the signs and symptoms of human intoxication and the related human diseases as a sequence of environmental exposure are listed. This is the title page for presentations of the Erasmus project ToxOR, Learning Toxicology through Open Educational Resources. And now let us go back on the topic and include some more detail. The presentation intends to acquaint briefly with the main chemical and toxicological properties of a group of pesticides, named in journalistic jargon as the Dirty Dozen. The Stockholm Convention on Persistent Organic Pollutants banned or greatly restricted 12 chlorinated organic compounds which are highly toxic and which are able to accumulate in the environment and to magnify through the global trophic network. Among them are 11 pesticides. These pesticides are listed in annexes A, B, and C, respectively, of compounds for elimination, restriction, and limitation of unintentional production. Aldrin, Annex A. It is toxic to humans. The lethal dose for adult men is about 5 grams. Signs and symptoms of intoxication include headache, dizziness, nausea, general malaise, and vomiting, muscle twitching, myoclonic jerks, and convulsions. Chlordane, Annex B. Higher concentrations of oxychlordane increase the risk of cognitive decline, liver damage, peripheral arterial disease, prostate cancer, type 2 diabetes, obesity, risk of non-Hodgkin lymphoma, and Parkinson's disease. DDT, Annex B. It's an endocrine disruptor and causes developmental and reproductive toxicity and disruption in semen quality, menstruation, and gestational length. It is considered as a human carcinogen associated to pancreatic cancer, liver cancer, and biliary tract cancer, multiple myeloma, prostate and testicular cancer, endometrial cancer, and colorectal cancer. Dieldrin, Annex B. It is toxic to humans and it has been linked to health problems such as Parkinson's disease, liver and biliary tract cancer, and breast cancer, and also to immune, reproductive, and nervous system damage. It is also an endocrine disruptor, acting as an estrogen and anti-androgen, and can adversely affect testicular descent in the fetus if a pregnant woman is exposed to it. Endrin, Annex B. Exposure to endrin can occur by inhalation, ingestion of substances containing the compound, or by skin contact. Symptoms of poisoning include headache, dizziness, nervousness, confusion, nausea, vomiting, and convulsion. Acute poisoning affects primarily the central nervous system, acting as a neurotoxin, which blocks the activity of inhibitory neurotransmitters resulting in seizures and death. Heptachlor, Annex B. Humans are exposed to it through drinking water and foods, including breast milk. The International Agency for Research on Cancer, IARC Paris, and the EPA, the Environmental Protection Agency USA, have classified the compound as a possible human carcinogen. Hexachlorobenzene, Annex A and Annex C. Its half in human is estimated to be in the range of 6 years. The most sensitive target organs are the liver, the ovary, and the central nervous system. HCB is well known to induce porphyria through a free radical generation mechanism due to its rather unique chemical characteristics of lipophilicity. Chlordecone or kepone, Annex A. In a kepone production plant, a number of workers are clinically characterized with illnesses as nervousness, tremor, weight loss, obsoclonus, pleuritis, and joint pain and oligospermia. Hexachlorocyclohexane, Annex A. The EPA and WHO both classify lindane as moderately toxic in agricultural uses and chronic occupational exposure. Exposure to large amounts of lindane can harm the nervous system, with symptoms from headache and dizziness to seizures, convulsions, and more rarely death. The International Agency for Research on Cancer, IARC, classify lindane as a human carcinogen. Mirex, Annex A. It causes fatty changes in the liver, hyperaccessibility, and convulsion in test animals. It is a potent endocrine disruptor, interfering with estrogen-mediated functions such as ovulation, pregnancy, and endometrial growth. It also induces liver cancer by interaction with estrogen in female rodents. Toxafen, Annex A. When inhalated or ingested, it can damage the lungs, nervous system, and kidneys, and may cause death. The major health effects involve central nervous system stimulation, leading to respiratory failure and convulsive seizures. Toxafen is linked to liver and kidney cancer and bronchial carcinoma in test animals, and so it is classified as a probable human carcinogen. At the end of the presentation is the closing page of the Toxor project, where you can see the logos of the participating educational institutions from 7 European countries.